Hi, I'm Dr. Frederick Echols, Acting Director of Health and Health Commissioner for the City of St. Louis. As the COVID-19 pandemic continues to impact our community, you continue to have questions about ways to protect yourself and your family from SARS-CoV-2 virus. Today's questions come from your emails and phone calls, as well as some new information released. Michael from zip code 63108 asks, does the current city mandate requiring masks in public spaces apply to apartment house lobby and elevator areas, which are exclusively in residential buildings? If the general public can use the lobby or elevators to move throughout the building, then anyone using these routes should wear a facial covering to protect themselves and those around them. By wearing facial coverings in these types of spaces, we all can work together to limit the transmission of the SARS-CoV-2 virus, the virus that causes COVID-19. Sarah from zip code 63116 asks, with school starting again, what should happen if someone tests positive for COVID-19 in my child's school? Parents, be sure to talk with your child about the proper ways to wear a facial covering, especially at school. Facial coverings need to fit snugly around the face and cover both the mouth and nose completely. Coverings with vents should be avoided as this can allow particles to escape, including the virus. If you are notified by the school that your child has been exposed to COVID-19, it is important to follow all guidelines, including keeping your child at home to prevent the further spread of SARS-CoV-2. Contact your child's doctor if your child begins to develop any of the symptoms of COVID-19, including fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, or diarrhea. Carla from zip code 63107 asks, do we need a booster shot if we receive the Pfizer or Moderna vaccines? If so, when can we get it? Vaccines provide our bodies an opportunity to prepare for a disease before we are infected, allowing us to fight off any potential illness with a stronger defense. Over time, and as new viral variants emerge, our bodies may need an additional reminder or boost to prevent serious illness. While studies and data analysis are ongoing, federal health officials have concluded that a booster shot will be needed to maximize vaccine-induced protection and prolong its durability. At this time, boosters are not yet available for the general public. Once that does occur, you should wait until 8 months have passed since your second dose before you receive a third dose. You also need to know which type of vaccine you received and plan to get the same one. Booster doses for individuals who received the one-dose Johnson & Johnson vaccine have not been announced, as it was released later than the Pfizer and Moderna vaccines. And Derek from zip code 63120 asks, I heard the FDA has approved the Pfizer vaccine for individuals 16 years of age and older. Can you tell me more about this? FDA-approved vaccines undergo the agency's standard process for reviewing the quality, safety, and effectiveness of medical products. This announcement gives the first full approval of a COVID-19 vaccine, something that many Americans said they were waiting for before they would consider receiving the vaccine. To date, 92 million Americans have been fully vaccinated with the Pfizer vaccine, including more than 70,000 individuals in the city of St. Louis. Thank you so much for tuning in this week. I look forward to joining you next week for more critical public health information. Let me hear from you, St. Louis. Please send your questions to health@stlouis-mo.gov. Questions will be answered in the order they are received. If I run out of time on air, your question will be answered by return email. Be well, St. Louis.